morning, Julie.
How are you?
I'm good. How are you?
I'm great.
We've known each other a long time, but for our viewers, I want to introduce myself. I'm Julie Shoemaker, and I'm the Executive Director of Training Engagement at the Health Center Foundation at Sidney Regional Medical Center.
And I'm Julie Slagle. I am a registered nurse, and I am the Vice President of Patient Care Services at Sidney Regional Medical Center.
Thank you for being here.
I'm excited. This is it. We've been waiting for this.
Yes. We wanted to start a podcast so that we could share information about what it's like to work in healthcare.
Yes.
And so this is where this whole thing begins. I want to share because I believe, I'll tell you a little bit of backstory just about me.
Yeah, do.
To get started. Okay. I believe truly in my heart of hearts that people are magic at their core when you can figure out what it is, that thing that lights you up and makes you who you are. I'll back up a little bit. I grew up in Sidney, Nebraska, born and raised my whole life here. I left to go to college, never really thought I'd come back. Ended up with a degree in sociology and religion. I happen chance just did it because it was fascinating and interesting. Still didn't have any idea what I was going to do for work after that, trying to put the pieces together all along the way. But we did move back to Sidney. I started working in long-term care for Judy Frericks in social services. And that role really, I never worked in healthcare up until then, had no clue what was happening in the healthcare arena. Judy grew me, raised me, instilled all the things that I needed to start to work with teams, understand healthcare better. But it also ignited the passion in me I always knew I had for people. And that position was so incredible because I got to work with the residents, I got to work with their families, and I got to work with our staff every single day. And each one of those three components required a different level of understanding and how to build relationships. I very much learned how to build relationships differently among all three of those avenues. So I, along the way, got into Clifton Strengths, Gallup's Clifton Strengths. SRMC helped me get certified in coaching in that, which then led into just fueled the passion for helping people understand why they like to do what they do, those inherent traits that are in each one of us, and understanding that if we find a way to get to use our inherent traits every single day, it becomes a strength and it becomes that thing that inspires us, that motivates us, that lights us up every single day when we get to do the thing that we naturally do best. And so it is such a privilege that I get to work with our teammates to help them fine tune those strengths, make sure that they're using it to the best of their abilities, get to use it more while also curbing those blind spots a little bit. That's been a huge realization for me. So that's what's led to this. And this podcast, I wanted to start this because the people are the magic. Healthcare is nothing without people. Every single person showing up every single day to do what they do best. And so I want to share those stories. I want to share what got people into it, why they stayed, what they've learned, and share that knowledge with everybody else out there.
I think that sounds great. I've been waiting for this. I think this is amazing. This is something that's going to take us down all sorts of avenues for our listeners. I love the magic of the people, but it's also the magic of the caring.
Absolutely.
And why we do what we do and who we touch and who it affects. This is going to be great. And along the way, we're going to learn a lot about what we do at SRMC, what we do about our people, each other, and our community.
And why we do it. Right?
Why we do it, why we love to do it.
Yes.
Exciting. Okay, what are we talking about?
Well, that leads right in, Julie, to what I want to talk about today. The stories about humans, right?
It is the magic.
It's the magic of what makes people that thing that makes them who they are, right? That special thing that they bring forward. That's what I want to talk about today. All of those stories that equal up to the people that we become, right? And how we lead and how we grow and how we develop others.
It's a passion for something that maybe somebody else doesn't have.
Exactly. It's finding your passion and how you use it.
Right.
And I think in a way of service, when we apply this to healthcare, like the magic of care, we're going to talk about, because we're Sidney Regional Medical Center. And so I want to talk about care because that's our number one thing that we do every single day.
Have you ever seen that movie, Marshall?
The football, is it a football movie? Yes.
And you know how they always say, we are Marshall? Well, we are
Sidney Regional Medical
Center.
Yes. And we provide extraordinary care.
All the time.
Yes. And so that's what I want to talk about is the magic of the people that provide that care every single day.
Okay.
So I want to go back to a little bit back for you. You've been doing this nursing business for a little bit.
42 years.
So what I want to know,
who'd have thought?
42 years. Like, that's incredible.
I know.
It's incredible. So I want to go back. What got you into nursing?
I don't know. Just a love of medicine. I think at the time I grew up on a farm.
Okay.
And lots of animals. I also had friends at that time in high school who were going into medicine, and I really didn't know. There was a time I wanted to be a high school music teacher, which is a second love of mine, maybe a third love. I don't know. I have a lot of loves. But I did go to nursing school. I went to Bryan School of Nursing in Lincoln, Nebraska.
How has that experience going to nursing school and staying in the nursing industry for the next 42 years, how has that impacted you?
It's a wild ride. It has made me who I am today. Very independent, very interested in people, history of people, who they are. Where did they come from? How did they get here? How can I impact them? How can I possibly, if the timing is right, make their last days the best days? What can I share with them that I've done that might make their life better? It's just all about the connection with people. And in healthcare, we do it different. It is difficult for me to be in a huge room with a lot of people. It's not difficult for me to talk. I can talk about anything. I love to teach. I love to talk. I love to share my experiences. But sharing it one-on-one with another human quietly is so impactful. So impactful. You know, I started in this, I spent the first 10 years of my career working in eastern Nebraska in the larger facilities. I worked at Bryan, I worked at Clarkson, in Omaha, the larger facility. Somewhere around year 10, I realized I needed to spread my wings and get out.
Okay.
So I started as a contract nurse. Contract nursing has been around that long. And so I did some extra shifts while working at Bryan, and I'd go out to smaller communities in Nebraska and fill in on the weekends. And that got me to critical access hospitals, long before they were critical access hospitals, and the love of rural communities. And I was able to combine that with my passion for history. And I came to Sidney.
When you think about those big facilities versus the smaller ones, because then for the next 30 some years, right, you've been in a smaller facilities.
I've been in Sidney since 1996.
How do they differ? Like, just not from size and volume, but how do they truly differ in the care that you see is provided, or that you were able to provide?
When you're in a larger facility, as a nurse, speaking as a registered nurse, the patient-to-nurse ratio in a larger facility is much greater. You might have 7 patients to 1 nurse, 8 patients to 1 nurse. Now, I worked those 10 years on the night shift.
Okay.
So our ratio was different than the day shift because we don't have the 3 meals, we didn't have the bathing, but we still had a number of patients per nurse. The smaller hospitals are fortunate at times that we can reduce that ratio just a little bit, and maybe you have 4, maybe you have 5. On a busy day, you might have 6. But that allows that nurse to have more one-on-one time with each patient.
Okay.
That's the important part.
That's incredible. When you think about your development over the past 42 years of your career, what stands out as a proud moment or a milestone for you?
Wow, I don't think there's anything that doesn't stand out. I was at the bedside for a long time. Then I decided to start working on my bachelor's degree and my master's degree in nursing. I didn't have that. I was the last class at Bryan that graduated with a diploma.
Okay.
Which was a 3-year. You have an associate degree, you have a bachelor's. Well, in the middle there, they put a diploma nurse. And I was a diploma nurse, but it took me a while to get that last year completed. Once I graduated, I wanted to work. I didn't want to go back to the university and finish another year. So it took me a while to get motivated and to a point financially where I could back off on working and go ahead and finish my degree. So I finished my bachelor's and I got my master's in 2009. And at that time, I decided I wanted to teach. So I went to teach for Western Nebraska Community College here in Sidney in the LPN program. And I was there for 7 years, and the opportunity came up to come over to, at that time, Memorial Health Center. So I joined Memorial Health Center at the same time Jason Pettick the CEO, joined, and I've been here ever since.
Oh, I love it. How have you managed the ups and downs? I think through healthcare, when you talk about looking at over the past 42 years, and even the past, I'm going to say COVID was a huge impactful part for everybody that will leave a lasting scar in all kinds of ways. How have you managed those ups and downs throughout those big, huge changes in healthcare?
My faith in God. My faith in God and the support of my husband, Brian.
Okay.
That's how I do it. I will always love nursing. I will always love taking care of people. I will always love every aspect of healthcare. But my faith in God got me through COVID and the support of my husband, knowing I could go home to him every night after a busy day. And God walks with me every day, so I didn't have to go home to him. He's there all the time.
Yes. Oh, that's wonderful. What advice would you give to people starting out? Somebody's thinking, healthcare, I'm not sure, is this for me or not? What would you want them to know if they're considering it?
Slow down and enjoy the ride. Enjoy the ride. There's a lot of times people, both men and women, they're getting into healthcare right now because maybe they want to be a nurse practitioner. Maybe they want to be a CRNA. Maybe they want to be a physician. That's great. I want everybody to achieve their goals, but slow it down a little bit and enjoy the ride, because the things that you learn as you're stepping through your profession will carry you every single year to your goal. I could not have succeeded obtaining my master's and then teaching for those years had I not have my background of bedside nursing, of being there with those patients who are bringing new babies into the world, or they're dying and they need somebody to hold their hand as they're going through the final phases of life. Every single aspect of what you do as a healthcare provider is important. It is this is what I thought of the other day. It is the only profession in the world where a stranger would allow you to touch them. You know, people are arrested for touching people. Some people say it's battery if you touch somebody. I mean, but healthcare is the only. If I walked up to somebody in the hospital who's a patient and I lift up the back of their shirt and I stick my stethoscope on their back and I start listening to their breath sounds, they don't turn around and yell battery at me or stop touching me. This is the only profession that gives you that trust and that respect instantaneously. We have huge impact on people.
I love all those things you touched on. I love that you touched on slow down, because sometimes that experience, I think we take for granted that we need those building blocks to be able to pass on to that next step, right?
I agree.
And so the experience is huge. I have a young niece and nephew, 20s, getting out of college, and they made the comment, they both agreed on this, that they felt that enthusiasm was more important than experience. And I laughed. I said enthusiasm's a huge part of it, but I said you can never take away, like you said, that bedside time, that learning to care for patients, learning all those little things along the way that then you're able to draw on that experience as you start teaching other people. How do I know how to teach? How do I know this? Why should you trust me that I'm telling you?
Why should you trust me?
Yes.
Because I've been there. I've walked in your shoes.
Yes.
The other thing that I think it's important to understand is we talk a lot about the differences in generations. I am the last of the baby boomers, and I'm looking at retirement as staring me in the face in a few months, or a few years, I should say. That scares the heck out of me, and that brings tears to my heart and tears to my eyes. But I'm the last of the baby boomers. You have the millennials, you have the, Gen Xers, Gen Ys. I'm not familiar with them, but you have all of these generations. And you hear people say, oh, that's just their generation. They're different. They may be different, but the heart of healthcare is the same across all of those generations.
Right.
And what a Gen Zer or a Gen Xer can bring to healthcare is the same thing a baby boomer brought. It's the love of people. It's the love of caring. It's the love of one another is really what it boils down to.
When you're talking about that personal care, somebody's allowing you to touch them. Working in long-term care as many years as I did.
Oh yeah.
When you're with a resident and you are able to meet a need of theirs, and you're this close to them, your hands are on them, you're looking them in the eyes, there is no greater privilege in this world. From my opinion, there's no greater privilege in the world than to care for somebody in that way.
Absolutely.
And
they might be at their worst.
Right. And somebody showing kindness and care and compassion. How difficult, it's not always easy.
No.
Have you ever had some challenging patients? Like, has there ever been moments along the way, or how do you coach somebody, or how did you do it? Sometimes when you got to dig deep, there's frustrating days. There's frustrating days when I think not everything goes the way we think it's going to go, right? These are people dealing with people and processes, and systems go down and equipment breaks and things don't come on time, or whatever any of those challenges may be. How do you manage those? And then how do you also coach others to manage through those?
Deep breath. They always say if you can stop for just a few seconds, take a deep breath, things will calm down. That is true. Take a deep breath. That taking a deep breath allows you to see it in a different light. And sometimes you can see it in your patient's, through your patient's eyes while you're taking that deep breath. That changes your whole perspective.
What exciting, I want you to share the most exciting thing that's happened at Sidney Regional, that we haven't seen this before in our time there. Do you want to talk a little bit about like the coolest thing that's gone on?
Yeah.
Okay.
Tuesday we celebrated our 5-star ranking, 5-star rating. That is pivotal. That is, we hit our strategic goal for quality. All the work that everybody in that organization has put into not only patient satisfaction, but service and finance and doing it right, providing that amazing care. We hit 5 stars. Do you know what that means?
No, tell me more. Okay. I know a little bit. Tell me more.
Okay. Well, CMS. CMS stands for the Centers for Medicare and Medicaid Services. They are the overarching governing body for Medicare and Medicaid. And so if you have a hospital that receives any dollars from Medicare and Medicaid, Medicare or Medicaid, you are required to follow their regulatory standards. Mm-hmm. Within those regulatory standards is something built called HCAP scores. It is not required for critical access hospitals, and we'll talk about critical access hospitals next, but it's not required for critical access hospitals, but we do participate in it. And HCAPS stands for Hospital Consumer Assessment of Providers and Systems. So in a nutshell,
I was going to say it in plain language.
That's why we call it HCAPS. In a nutshell, it is a survey of all hospitalized patients after they've been discharged home, and we are asking them questions about certain aspects of their hospitalization.
The patients are grading us.
Patients are grading us.
Okay.
And they're grading us on their communication with nurses. Was your call light answered timely? Did the nurses answer your question? How did you feel your nursing care was? Do you feel like they were knowledgeable, etc.? Then there's those same standards for communication with your provider or the medical physician, nurse practitioner, whoever cared for you. There are questions relating to your medications, which has to do with pharmacy. Were you instructed on the medications that you're taking? Did you have thorough understanding of medications that you're getting sent home on? How will they work? What are they used for? How to take them properly? Mm-hmm. When was your last dose of a certain antibiotic? So you know when to take it again. There are questions about, was the hospital quiet? Because, hospitals are busy, but we still need to keep the noise level down because this is a place where people are resting. Is the hospital clean? Is your bathroom clean? Do you feel comfortable in your room? Then there are questions about discharge information. When you were sent home, how well were you educated on what was wrong with you? how you're going to take care of yourself, how you're going to prevent yourself from coming back to the hospital. And if you don't get better at home, do you know what steps to do to come back to the emergency room or to see your primary care provider? There's approximately 27 questions that fall into all of those categories. Then there's 2 final questions. What's the overall ranking of the hospital? Mm-hmm. And would you recommend us to your friend or loved one? Mm-hmm. We have, for the past number of years, worked our way to a 4-star. We've always wanted to be a 5-star, which is that's the cream. I'm not the cream. That is the highest you could be. HCAHPS scores are the 4 prior quarters. So we just got the summer of 2025 back a year. Those scores came out and we have attained the 5-star ranking. So we celebrated. That means that we've met some of our goals. Once you're there, there's always more to attain. So we'll continue to work. But what that tells us is it validates what we're doing. It validates the processes that everyone at SRMC has worked so hard to put in place, that we are on the right track to be the best in Western Nebraska. And we'll take our information from those, we'll adjust our processes, and we'll keep going forward.
It's incredible.
Oh, it is so incredible.
When you think back to developing the people, because it's the people every single day showing up to work doing those jobs, from housekeeping to nursing to radiology to lab, every single person showing up to fill their piece of the portion, right, to care for people. When you think about the development of them, what is a huge takeaway on something that you've learned through this process of the last 15 years at the hospital?
It's their strengths. Okay. We've spent a lot of time with Gallup and you working on strengths, understanding where someone's strengths are at helps you understand the magic of that person. And it is about the magic of that person. But I know what your strengths are. Your strengths are not the same strengths that I have. Mm-hmm. However, by knowing what your strengths are, not only can I communicate better with you, I can work more strategically with you. And together, the outcomes are amazing with what we can do with our people. Mm-hmm. That's been the greatest takeaway. We've also changed the culture at SRMC to a culture of kindness, love for one another, proceed till apprehended. Just do it. Mm-hmm. Take care of the patient. Just do it. We'll talk about it later. Having each other's back. We are a family. You know, people say, what's it like working there? It's like working with your family every day, because you know, from housekeeper to Jana in laundry to JP behind his housekeeping cart to Adam and his team, everybody has your back. Mm-hmm. Everybody has your back. What a better place to work.
Yeah. One of the coolest things I think I've seen with that culture is that the patient comes first. Jason, our CEO, has done such a good job of saying this statement, and it means so much, that every single thing any one of us does at work every single day will eventually land up in the lap of the patient.
Yes.
And so knowing that, I think having that same strategic vision that we're showing up every single day to take care of people, that it has helped people to, I think, empower them, that proceed until apprehended, that Absolutely. We're going to do whatever we need to do the best way possible, right? The safest way, the right way to take care of the patient. And we're going to help each other figure it out. Even if we disagree sometimes on what that might be.
And we might disagree.
Yeah, and
that's okay. That's how we all grow.
How do you coach people through those disagreements? Because sometimes we get passionate. Sometimes our stance is different than somebody next to us, right? We've got a different perspective on it. I would choose a different path, maybe. How do you help people? How do you help coach people through that if they're at a standstill or they're struggling?
Walk in their shoes. Take a deep breath. Remember the mission statement. Mm-hmm. And really, it's a matter of communication. Okay. It's general. You know, electronic communication is great. It can be done quickly, You can get an email out. However, there's nothing like having a face-to-face conversation.
Yes.
And sometimes you just need to pick up the phone or you need to walk down the hall and do that.
Yes.
You know, you were mentioning something about Jason.
Yes.
And I think one of the best things about working for Jason is he's right there with you.
Yes.
He's not the CEO sitting in his office. He is out and about all of the time, but he walks the walk just like the rest of us do. And in 2024, when we got together as a team and developed a new mission statement, I think that was huge. A lot of organizations, they get the mission statement given to them by their governing board, or their leadership team gives them their new mission statement. I remember that meeting where we sat up at Hillside as a huge group, a team, and we determined what things needed to, what was our mission? What was our vision? What was our value? How are we going to get there? And the group came up with extraordinary care always as our new mission statement. And because everybody had the buy-in, it's been so easy to get there.
Yes.
Takes a lot of work on the backside. But when I say easy, if you can keep that on the forefront, it highlights your day, and that's easy to do.
Yeah. When everybody's moving in the same direction for the same reason, has the same goal at the end of the day.
Absolutely.
Yeah. What would you say is the greatest challenge you currently face?
Staffing.
Okay.
Staffing. I don't know. What is the generation called now? Gen Z? Gen Y?
Yeah.
I don't know.
We're to Z. The little ones are Z's. We're to Z's.
Little ones are Z's. So the ones coming out of college right now, are they still Z's?
Yes.
Okay. They're mobile, man. They don't want to stay. I have a niece that lives in Florida.
Commitment phobic.
I have a niece that lives in Florida, and she is on the move.
Yes.
She just wants to be able to pack up her little car and go.
Yes.
She doesn't. Yeah. I think that's awesome for that generation, but that makes it a little bit more difficult for our organization because it's hard to attract and hold on to staff. It's not that they don't like it here. They don't go.
Sure.
What's next? What's next? Where are we going to go?
Yes.
But staffing in all of the healthcare areas, COVID did us no good in that it scared people out of going into healthcare. So we're trying to play catch up with that. But we are making our headways, and staffing is our biggest challenge.
Was staffing better 15 years ago? Was it easier?
Yes.
Okay.
It was.
More people in the industry, would you say?
More people in the industry. You know, the nurses alone, the number of nurses that they predict are going to get out of the profession in the next 5 to 10 years are tens and 20s of thousands of nurses in Nebraska alone.
Okay.
You know, the other thing that scares me or challenges me is my own retirement. I'm not ready. So we're not going to talk about it.
We don't have to talk about that for sure.
No.
For sure.
No.
What's your greatest hope for the future?
In healthcare?
Yes.
That we continue to make strides and improvements in overall care of hard to cure diseases. Now, I would love if we could slow the whole rate of cancer down across all of the spectrums of cancer. We could slow that down. AI's done a lot for us on helping us with intellect and knowledge and all of that, and being able to make our systems and our processes the same. But curing some of these diseases, being able to intervene sooner on a disease. And I hope that we can get staffing back up to a point where all hospitals are not challenged.
Thinking about the magic of people as we start to, is there anything else you want to add before I ask you this last one? Is there anything else that we didn't touch on so far today that you want to make sure we do?
No, we just talked about everything.
I know.
I mean,
when I think about the people, though, when I think about the magic of people, and we have the great privilege to see people I see them every single day performing at the top of their game. They are playing into their strengths. They are doing what they do best. You can see it with the passion that they show up for, with the passion that they'll fight for patients, for the right care, for the
Right.
time, all of those things. How do you, as we think about healthcare, we know we need more people in it. We want people playing to their strengths. How would you encourage somebody to even begin to evaluate, is this something for me?
Spend a day with us.
Okay.
Spend a day with us. And you had just mentioned something about showing up for each other every day.
Mm-hmm.
It's not just showing up for each other, it's showing up for our community.
Mm-hmm.
As you know, we had the unfortunate event yesterday out at Walmart.
Mm-hmm.
We were ready.
Mm-hmm.
We didn't publicize it much at the hospital, but we had key players in the right places. We were ready for our community. And so we show up for each other every day. We show up for ourselves. We have to give ourselves credit. We show up for ourselves every day, but we show up for our community. We show up for Western Nebraska, and they need to know we're there when they need us.
Mm-hmm.
That's the magic of this.
Truly, truly. Julie, thank you so much.
Thanks,
I
Julie.
appreciate all your time today. Thank you for sharing all your knowledge and experience with us.
Thank you.
Yes. I hope you enjoyed our first episode.
I do too. It was fun.
It was so much fun. I love visiting with you. I could learn something every single day, Julie.
We could just sit and talk all day long.
Yes.
Except our coffees are kind of getting cold.
They're getting cold and empty, so
Yeah. So
thank you.
You're welcome.
If you enjoyed this episode, please like and follow us. We're going to have another episode coming out soon.
If you have any questions for us, or you want any more information about Sidney Regional Medical Center, they should reach out to us on either a phone call, 308-254-5825, or they can go to our website at sydneyrmc.com, or like and post on Facebook. Like and share.
Like and share.
I'm not a big...
I got to ask my kids how to do it. Like and share.
Like and share.
We'll see y'all soon. Oh, don't forget Instagram.
What's that?